Hi and welcome to Lessons from the Grand Rounds. In this short video, we'll be discussing a clinical case and I'll be asking you three important questions in this clinical vignette and I'll be releasing the answers in the next 24 hours. So we have a 45-year-old male who has type 2 diabetics in the last 3 years. He is uncontrolled diabetic on OHs and insulin. This patient is admitted with us as a case of relapsed BALL with two chemoimmunotherapy based protocols before. And for the salvage chemotherapy before a definitive plan of CAR T cell therapy, this patient is given flag-based chemotherapy with venetoclax. On admission, on the day one of admission, the patient's TLC is 540 with an ANC of 50, and he is put on posaconazole prophylaxis, posaconazole for the mold prophylaxis, and the patient receives the chemotherapy 4 days of flag-based chemotherapy with 10 days of venetoclax. And on day 22, this patient currently has the TLC count of 60 with ANC absolute neutrophil counts of 0. This patient has a complication during the ward stay on day 16 of the therapy with bloodstream infection of CRK and DMOXA, for which he receives 6 days of zaviceftazolam as of now. On day 21, which is a day before, so since 2 days, the patient initially complains that he has pain on the right side of the buccal cavity, and today he develops right-sided cheek swelling, which is painful. There is a swelling which is palpable on examination with the tenderness on examination. So this is the whole scenario of the patient. So my first question is, what are the differentials to this clinical condition or complication of the patient? The second question is, how would you further evaluate the patient and would you like to change the antifungal? The third question is, what are the risk factors in this particular patient? Thank you.